Hi everyone, we're just going to run through how to set up our high flow humidified nasal prong oxygen. We normally do have this pre-set up, but I think it's a good thing to understand so that you can troubleshoot, or in the event it's not set up and you need to set up, you know how. So all you need is a 1000 ml bag of water for injection, the high flow nasal prongs setup kit, some oxygen tubing, bunny ears, and the nasal prongs, and that'll get you to the point of popping it on the patient. So what we'll start with is popping a bag of sterile water up there. We'll then connect, or make sure that we're connected to oxygen and medical air, and that we have a power supply. Then you'd grab your kit, open that up and take everything out. So you have a little canister here, push this blue bit in and then slide that one in, and then just unwind the tubing here, and then you'll need to spike this water for injection bag with it. This will actually self-prime into the canister down here, so you don't need to do anything more than spike the bag. In our kit, you'll find that you'll have 2 pieces of corrugated blue tubing that comes with it. This shorter 60 centimetre piece is actually redundant with our setup, so don't let that confuse you. Throw that away or donate it to a kindy or something, whatever you want to do. Recycle's good. And then this is the tubing that you'll actually use. 2 different ends. You've got the single port end, which is going to go to the patient, and then you've got 3 different ports on this side. What you want to do is attach this large port onto one of the openings on the canister there. Alright. Alright, next thing you want to grab your bunny ears. Pop your bunny ears on the other port there. Grab your oxygen tubing. Your oxygen tubing will then connect onto the bunny ears and to your high flow meter. Now for adults, you want to have the high flow meter that goes up to 60 litres a minute on here. For paediatrics, you'll need to discuss your plan of action with the doctor on how big the child is as to what meter you use. You might just use the normal flow meter, so up to 15 litres, or the low flow meter up to 2.5 litres a minute. So yeah, connect those 2 up like so. And then what you want to do is connect up all your probes so that you can actually get your temperature readings and humidity readings. So there are 2 different connections. They look quite different to each other and they only fit into one port. So if you come down to look at the blue corrugated tubing bit, down here, if you pop the cap off, you'll see that you've got an opening there and it's got a bit of a triangle shape to it. And this probe has a triangle shape to it too. It only fits in one way. Pop that in until it clicks. Perfect. And then you want to take this probe to the patient's end and connect that to that port there. Finally, you want to grab your nasal prongs. Different sizes for pediatrics and adults. Just doing an adult setup today. Connect that one in there and you're ready to go. With the high flow meter here, you can decide on the litres per minute that you want. Just ask the doctor what they suggest, and then here is your air oxygen blender. So we always like to suggest to start at 100% while the patient's in respiratory distress, and then wean down. You can wean down all the way down to room air, and then you could just provide flow. If you have it set to 60 litres a minute, and the patient's mouth is shut and they're purely breathing through their nose, you can achieve up to 7.5 centimetres of PEEP through this machine. But as soon as they open their mouth, you're allowing that pressure to escape and it drops down to 2.5 litres a minute of PEEP. But just, speak to your patient, tell them what's going to go on, encourage them to breathe purely through their nose, and they'll get a lot better effects from it. If you have any questions at all, please pop the comments below or catch me on shift. I'm happy to talk through anything with you. But it's a pretty easy setup once you get used to it, and all you have to do is just press the on button on the machine and it heats up itself. Thanks.